We've got a topic that everybody wants to hear about, and that topic today is healthcare. As we all know, the American system is very broken right now, and I know as far as me and my family and a lot of families out there, we're looking for solutions in healthcare to make up for our high deductibles and other things that we have to deal with. And we have a very special guest today. And you're really changing the way that healthcare is dealt with down here in South Florida. You're spurring some healthy competition down here.
I'm really just here trying to fix healthcare. But yeah, I'm with a company called MrFixHealthcare.com. And we created a healthcare marketplace for people with high deductibles, no insurance, to go on, search for a medical service in their area, see the price, reviews, basically Priceline for medical services. So we launched throughout Florida.
And what's hard to believe is, you know, watching healthcare over the past years and watching what I see as very negative changes, and most of us feel that way. You know, one of the problems that we have is we're really a cash consumer when we're out there looking for healthcare at this point, or if we're looking for diagnostic services. And you're providing a way for a savvy consumer to go out there and be able to find the best price and the best service for them and their family.
Yeah, we're giving them an avenue to really go on and compare different services. I mean, the problem right now is the consumer doesn't have a benchmark of price. There's no place you can go to and see all the prices. We're trying to create that avenue starting in diagnostic radiology, so MRIs, CT scans, x-rays, and then expand into other specialties, into internal medicine, chiropractor services, so all the different services.
Little healthy competition for healthcare. I think it would be great if on a national level we were taking a platform like that and we were actually able to shop for healthcare services and know what they truly cost.
Yeah, I mean, I think our healthcare system is so broken, but the big thing is that it's only been the last couple of years that people have actually started to realize that healthcare has been broken. If you think about 5 years ago, people never thought about price because who was the actual consumer of healthcare? It wasn't the patient, it was the payer.
Yeah.
Whether it's the insurance company or the payer.
Sure.
Fast forward to the last couple of years.
Well, things certainly got worse with ACHA. I mean, in my opinion, you know, I think Obamacare was a total and complete failure. And it's failed all of us as Americans and consumers because it's really driven up the price of everything. It's doing exactly the opposite of what it was meant to do.
Absolutely. And so what has happened with Obamacare now, as a result of that, you have most consumers who are not having an insurance policy. Essentially what they do is they will get catastrophic coverage. And then the rest of the stuff they'll go to urgent care for and those kinds of things. So that larger, this didn't happen until Obamacare drove the healthcare market into the ground. And by the way, if you talk about who benefited from Obamacare, it's the insurance companies. It is Big Pharma. Those are the people who benefited. So for people to suggest that Obamacare is some great cure is absolutely ridiculous.
And listen, we could get into the whole Washington policy and the politics and the lobbying and Big Pharma and all the problems surrounding that because, you know what, it's all connected. And when we look at the opioid crisis and we look at the rising costs of healthcare and we look at the failure of Obamacare, there are some real common connections there, and a lot of them were caused by the prior administration. You know, I mean, I know we're not on a political rant here today, but when we segment out healthcare and we look at that as an issue for the American people, it's definitely an issue where it has been a partisan issue. And I'm hoping we can find a way to solve it now with the new administration. We'll have to see.
Absolutely.
Well, at least there's not the individual mandate anymore because I got taxed for the past couple of years, well, since I turned 26 and got dropped from my family's plan. But I personally don't have health insurance right now. I need to find a way that I can pay $50 for, let's say, real catastrophic coverage, and then use something like MrFixHealthcare.com where I can shop around and save money for everything that's in between that catastrophic that hopefully I never have to use. And my normal everyday healthcare expenses, like car insurance. I mean, that's really where healthcare should go.
Well, and you know what? I mean, that's a free market system, which I love. And you know what? As much as we can't fix the broken Medicare system we have and the things that we have very quickly, you know, it's not so easy to just repeal and replace. You know, it's not like we can just go in there. There's no magic bullet. This is something that's spurring healthy competition. It's allowing people transparency to see what they're really paying for. And maybe over time, I mean, our healthcare system may change, and it may go towards more of a model like this, where we have catastrophic coverage and we are paying out of pocket.
Well, and absolutely, the free market solution is absolutely the solution. To suggest, as so many politicians are, that government should run healthcare. Look, government can't even run the post office.
I know.
And so how would they be able to run something as complicated as healthcare?
Well,
it cannot be done.
And, you know, it's interesting, you know, they bring up the post office, you know, that's kind of a dying industry. And
Yes.
maybe the way that we've treated healthcare also is a dying industry. And maybe we need to completely take a look at that again and start from the ground up, because everything has changed.
I think one of the big things is employers need to be on board with this idea of competition and being a consumer. I mean, if you look at where most of the health care costs are being paid, it's the employer. I mean, any employer with 50 employees or above, I think it's like 80–90% are self-insuring.
Yeah.
So they're paying their health care costs. They're the ones who feel the pinch of out of pocket. So what have they been doing? They've been passing the risk along to their employee, creating higher and higher deductibles. And we want to work with employers, MrFixHealthcare, to be able to create a program that they can use our platform for their employees for that out-of-pocket expenses, so that their employees can really shop around, compare different services, get the best price for them, and their employer can have that whole health plan in one central place.
Wow, so you're even looking at it, and that's very interesting, because I didn't think about it that way. I thought about the consumer going out and kind of seeking you out. I didn't think about the HR side of this, where if you go into a company, you can actually get the HR to kind of fill the void that they might be passing along to their employees with your service.
Yeah, I mean,
Cool.
the individual consumer is great. I mean, people like me, I'm the individual and consumer. I'm going out, I need dental services, I need doctor services. If I, knock on wood, need an x-ray or an MRI. But really, where we can see change in our healthcare industry, with MrFixHealthcare and other innovations, is the employer needs to push the employee. They need to create these innovative programs that, whether there is legislation or not, most people are getting their health care through their work anyway. So it's that employer that can really make a difference right now.
Well, and what's happened with the American healthcare system is it is like the way that too many doctors are supposedly treating patients these days. They are treating the symptoms. They're not treating the cause. And that's the issue that we have with healthcare. So a lot of people showing up, they needed insurance coverage of some sort. But if you look at the mass kind of melding of a number of healthcare entities, you know, essentially what's happening is the price is going up and up and up. And I think certainly this administration is looking at that, and this administration is going to be the one that solves for that problem. It doesn't mean more regulation, it means absolutely less regulation, because the free market's gonna decide ultimately. And so I hear a lot of people on the left consistently talking about, oh, well, you know, the free market system, you can't just do that like you do consumer goods. Guess what? Of course you can.
Of course you can, but you're dealing with, when you speak to those people that really don't understand capitalism for the most part. And they also don't want to look at, what I feel is they don't want to look at the logic behind the issue, because you know it's dollars and cents. And we can't provide for social programs without creating revenue somewhere to cover them. So, you know, I'm all about the free market system. You know, I'm a capitalist. I always have been. And I feel like when we look at healthcare, we got away from that. You know, I'm all about providing things to those who can't, but we can't do that without a way to make money.
Yeah, and somebody's got to pay for it. And it is exactly as you said. Folks just simply don't understand the logic behind it. It is what I always say, which is the term liberal logic makes no sense.
Right. Well, the two don't kind of go together.
They do not.
We have a very logical solution
yes,
right here in what you're providing for a problem that we have. Whoever caused it, we have the problem.
Yes.
And we could go back and forth on the political side of that. But until we have a permanent solution, and I hope it's this administration, my fear is it's going to carry on for much longer than it needs to because we have people fighting finding a solution.
Yes.
And that scares me for the American people and for health care for all of us and our families. But, you know, here's something, at least in the short term, that we can do to take control of our costs.
Yeah, and I mean, that's why we developed MrFixHealthcare and launched throughout Florida. And the plan is over the next month, 2 months, we're going to be rolling out in the Northeast, Texas, Las Vegas, and then other kind of major cities across the nation. And then also start to add different specialties. So like I said before, we're X-ray, MRI, CT scan, but over the next, I would say, month, 2 months, 3 months, we'll have dental, we'll have vision, we'll have internal medicine, we'll have chiropractors. Sure. So it's exciting stuff, and I think by creating an avenue that, as Expedia did back in the day, creating a way that they don't have to actually have human interaction, pick up the phone and call. We create a way that no matter what the policy is, a consumer can shop around if they need to.
So in simple terms, it's an Expedia or a Priceline for healthcare. That's basically the service in a nutshell for those of you that are watching this. It's an Expedia or Priceline of healthcare, and you can get your services, find out what they cost, and shop accordingly.
Absolutely.